It's me Arvind Kumar Yadav, and now I'm going to present my topic. And my case is acute abdominal problem and vomiting in hospitals. So, talking about the patient case, let's see the patient profile. Patient is a 40 years old woman, and the symptoms of the disease is like she have a several abdominal pain and vomiting. And so, what was the our goal? So my goal is to rapid assessment and systematic diagnosis. And so talking about the legislations, there is a patient care in Finland is guided by key laws. There are some law we have to follow during the patient care in Finland. So talking about the Healthcare Act 1326 2010, so ensure the right to urgent care and treatment must be timely and appropriate, and act on the status and right of patients, which is made in 1992. A right to good care and respectful treatment to the patients, and patient must be informed about their condition and care. So doctors or nurse have to inform the patients what is the condition of the patients and what medicine we are going to give to the patients, and respect of the patient autonomy. And talking about the Act of Healthcare Professional, which is held in 1994, the professional must work within their competence and responsibility for patient safety. So every nurse and doctor have to take care of the safety of patients, and they have to work on their responsibility. They don't have to right to wear like a ring or any chain during the work time, and using the mobile phone is prohibited. And also talking about the data protection and patient records law. So in Finland, in hospitals or anywhere, like talking about the hospitals, doctor have to record all the documents or the details of the patients before the treatments. And talking about the patient's data protections, so doctor do not have right, doctor or nurse have right to click the pictures or any information misuse or mislead without the agreement of the patient. If patient does not give you right to share their details to anyone, then you don't have right to share. If they are, it is also if the patient does not tell us to share the information with their family member, then we don't have right to share. We first get permission from the patients. And this law ensures safe, ethical and high quality care in Finland. So next, talking about the care process, what care we are going to give to the patient. So talking about the diagnostics, blood test, and imaging, like doing ultrasound, CT scans, and possible gynecologic examination, because the patient have the abdominal pain, so we have to do these things to know what the problem and why the patient is facing this pain. So after that, we're talking about the treatment. So we have to do pain management, like giving some painkillers or injection or antibiotics to really relieve the patient from the pain, and also fluid therapy, possible surgery if there is any serious case like appendix, then we have to do surgery. Or there is also a callus. In normal word we know the stone, we call stone, and medical word that we call callus. If there is any callus in the abdomen, then we have to do the surgery. And talking about the interprofessional collaboration in the hospitals, there is a lots of staff working in one patient or every patient, like doctors, nurse, lab, radiologist. So in hospital we have to work in the group. Then we only identify what the situation of the patients, and also fast information sharing is essential. So in the hospitals, while we are working, we have to be active and share the information of the patient to each nurse and the doctor who are going to take care of after us. So treatment is based on quick assessment and accurate diagnosis. After that, we're talking about the interprofessional collaboration. This topic is already I mentioned before in this before. interprofessional because so a doctor, nurse, and a radiologist work in the group. And now we're talking about the unexpected situation and risks. While working in the hospital, there is just suddenly some patient have some problem, so we have to be ready for that. So heading is managing complications. So what should you do? Like first, talking about warning, so reputed ruptures appendix, shock drop in BP, and systematic like a language barrier, poor handovers. In the some cases, the like talking about the Finland has a lots of patients who don't know to speak English, but most of the students who come from like Asia or any other English country, so it is not possible to speak English Finnish within 5 or 6 months. So this is a one barrier. And what is the solution for this problem? So the solution is be prepared for rare condition like ectopic pregnancy. After that, we talk about the conclusions. So here are the conclusions. This case highlight is like the importance of rapid treatment, and also role of legislation is protecting patients, and importance of teamwork, impact of good communication on safety. Acute abdominal pain requires fast and accurate care to ensure the best outcome for the patients. Thank you so much.